Hi there, my name is Paul Michael. I'm a medical herbalist here at Health Matters in High Barnet, and I wanted to talk to you today about histamine and the role histamine plays in allergies. So I'll be looking at hay fever, as it's the hay fever season, and how herbal medicines and supplements can help benefit patients suffering from hay fever to reduce some of those awful symptoms that people suffer with. As a sufferer, you may well know that some of the symptoms include extremely itchy eyes, runny eyes, awful itchiness in the throat, which can be very aggravating, even going into the ears, extensive sneezing, extreme congestion in the sinuses, which can lead to headaches, irritability, problems sleeping. Histamine can affect people's ability to sleep well, and so on. So let's look at what histamine is. Histamine is an excitatory neurotransmitter. It's a chemical which excites and stimulates the nervous system. It's produced in the mast cells. Originally, they thought histamine was only produced in mast cells, but recent research shows that histamine can be present in all of the cells and all of the tissues in the body to a varying degree. Let's look at the type of patient that has histamine reactions and allergies and so on. But essentially, these type of patients are usually patients which have a low adrenal output. So the adrenal glands, which we've talked about in past talks, I think we covered a bit about the adrenal glands in the immunity video. So the adrenal glands, they're small glands about the size of a grape, and you have one above each kidney. These are incredibly important because they help your body adapt to stress. When you have stress response, the brain sends a message to the adrenal gland above the kidney, and that produces, among other hormones, cortisol, which is a steroid. Now, this cortisol is incredibly important in helping you adapt to stress. Now, that cortisol has an anti-inflammatory and anti-histamine, if you will, type effect in the body. So that cortisol is able to reduce inflammation and reduce the effect of histamine inside the body. Usually patients that have allergies tend to be patients which have an underactive adrenal function. So the adrenals are not working efficiently, therefore you're not producing enough cortisol. So when you're stressed, the histamine is produced. So essentially, the more stressed you are, the more stimulated your nervous system is, the more excitable you are, the more histamine you can produce as a stress response. And because your cortisol is not sufficient enough, the histamine is unchallenged. Now, histamine, as we said, is a stimulatory neurotransmitter. So it's a chemical which further stimulates and excites the body. So you can get trapped in this loop where you are very, very stressed. You have a lot of histamine inside the body. That histamine stimulates the nervous system even more, and that goes round and round in the loop. And you're hypersensitive, therefore you're reacting to things around you. You can become hypersensitive to perfumes, chemicals in the environment, or cleaning products and things, or pollen, certain types of pollen that you may have developed a reaction to, and then the cycle goes on. And because you don't have enough cortisol, the stress response is not adequate enough, the cortisol is not able to break that cycle, and it carries on and on. The question is, how do we break that cycle? Rather than just giving antihistamine, which can reduce the histamine and improve the symptoms, we want to try and work at the underlying factors in order to break this cycle and hopefully change the evolution of this problem. As you've probably heard, some people, they can have allergies to certain things, and they can grow out of these allergies. So they may not be lifelong. So, some patients of mine say, oh, I used to have hay fever, I don't have it anymore. Or I used to be allergic to this, and I'm not allergic to that anymore. And that's because this mechanism that we've talked about has been altered in some way. Whether it's a lifestyle situation that's changed, or maybe they've been taking a supplement, or they've changed their diet, or reduced the stress, maybe they've implemented certain techniques to reduce the stress and allow the adrenal gland to recover. Now, chronic stress, initially when you have stress, your cortisol will go up. you will increase the level of cortisol in the body. And if that carries on for long enough, if your cortisol stays high long enough, your adrenal gland will eventually get tired or get exhausted, and you will not be able to manufacture enough cortisol to meet the demands of the body and adapt successfully to stresses.